Welcome back for another Teaching Tuesday. I'm excited because I'm talking about noses again. Last time we talked about taking down the hump and why we have to break the bones. How about when we don't have to? See, sometimes we're working on the bones and sometimes we're just working on the tip. A lot of times we're doing both. Why would we be working on the tip? Well, sometimes it's just very wide. People say if it's rounded, it's a bulbous tip. Sometimes people actually have this boxy tip. And sometimes there are other situations, like this one's tip is hanging a little bit, and here I wanted to change this hanging to the correct angle. Sometimes there's too much nostril show, so I'm trying to fix that. Either way, when we're working on the tip, we don't necessarily have to touch the bones. See, the nose is nasal bones up here and then cartilage here. That part doesn't move. This part just moves a tiny bit. The tip cartilage complex moves a lot. And here you can see this cartilage here, that's one side of the tip. It's not actually attached to anything firmly. So if we get to the lower part of the nose, the tip cartilages, and we're suturing, maybe suturing this together to squeeze that and make a sharper angle. If we're doing the same on this side, maybe we're suturing this closer to make the whole nose narrower. Maybe we're doing something to create a better angle here. None of those things affect the nasal bones and cartilage necessarily. And so if we're not taking this down and leaving that open roof where it widens the dorsum like I talked about last week, then we don't have to break the bones. We can leave the entire upper 2/3 alone, and this is where you'd break the bones. We can completely leave that alone, do some work down on the tip. No bruising, right? Usually no pain at all. You get some swelling in the tip anytime you work on it, and it takes months for it to completely go away. But sometimes we're doing a tip rhinoplasty, and it can be a much smaller surgery. So sometimes if we're just down here, we don't need to do anything to the bones, no bruising. Sometimes when we're working on the dorsum, we do. Usually we're doing this and this together. And that's it for rhinoplasty, those two talks. We'll be on to something else next week. Thanks.